So I'm hoping I can get through this relatively quickly. I know it's late at night. Unfortunately, the hall was booked up until this time. This is the earliest slot we could get where we thought would be appropriate at a time when people could join us here. But I hope to get through the presentation in 30 minutes and leave plenty of time for questions at the end. And we will do our best as Crawley Health Action Group to answer those. Okay. So, just a reminder, this is your committee for the Crawley Health Action Group. Kevin, who's unavailable today, Marion, who's been acting as chair, Carol, Clive, and Philip here in the front row. And just, about me, I'm not an elected member of the committee, I'm just helping the committee with administrative support. So, who am I and why am I here? I am Sussex born and bred. I grew up in Slintwold, just west of Horsham. My family still live there. And I actually only moved into the Crawley Down area during lockdown, so in August 2020. So I've been here for 4.5 years. And personally, my experience of general practice with GPs has been awful. My wife and I, we researched quite a bit when we started in the area to say, well, actually, we've got a choice maybe of which GPs we could register with. Only to find out we had no choice. All of the practices just slightly to the north of us, so in Surrey, because of the West Sussex postcode, we weren't allowed to register with them. And the only kind of vaguely local surgery for us was the Crawley Down Health Centre that was accepting new patients. And we looked at the reviews on Google Reviews, and they weren't great, but we had no choice because we were coming across from Surrey at that time, and we had care that we needed to transfer into Sussex, and so we had to register somewhere. And so Crawley Down Health Centre was the only one that would take us. And there have been a few mistakes made in the journey of the 4.5 years we've been in Sussex, and we've raised complaints, and broadly I'm not being very satisfied by the responses I'm getting back. But I contrast it to my mother-in-law, who came to live with us last summer. And because of our experience, because of what we learnt, and because she was going to be going to a nursing home just to the north of East Grinstead, we were able to get her into registered as Mokefield. And it was like chalk and cheese. Mokefield could not have been more supportive and more helpful of an 86-year-old woman who had various needs. She had kind of treatment and training about how to manage diabetes. She had her cataracts done within, I think, a month and a half. She had an appointment with an audiologist. She got hearing aids done very quickly. It was very perplexing to us why Mokefield could do all of this, and yet we were struggling just to get a basic GP appointment in Crawley Down. And I retired 2 years ago. Very, very fortunate that I now have a bit of time on my hands, and I decided to start digging. Start finding out what was really going on and why there was this massive disparity in the quality of care between two surgeries less than 10 minutes drive apart. And as that process, I came across the Crawley Health Action Group, and I started inquiring about what was happening and what they understood, and I basically offered my services at that time. And so this presentation is going to be broadly what I've learned in the last month, through talking to people, through being invited to meetings with the Care Quality Commission and NHS Sussex, talking to patients such as yourselves, and doing my own kind of research and kind of digging in. So, the good news, right, I want to get this up front. If we decide we are unhappy with what's happening, we can complain to Modality, who run the local service, but we also have two authorities that actually have quite a lot of power. So one is the Care Quality Commission, the CQC. They are responsible for checking that care is being provided and to a suitable standard. So Marion mentioned at the beginning that the Care Quality Commission inspected Crawley Down Health Centre and 3 other surgeries that together make up what's called Modality Mid Sussex. They inspected in May and June of 2023, and then they produced a report in September. 3 months later, they published a report that said Modality Mid Sussex was inadequate. What is inadequate? Inadequate is the lowest possible rating the Care Quality Commission can provide to a GP surgery. What it means is they said they were placing Modality Mid Sussex into special measures. They said they would be back within 6 months, so by the end of March 2024, and that, frankly, if they didn't make improvements, they had the right, as a regulator, to shut Modality down here in Mid Sussex. So it's a little bit like when Ofsted go into a school, they conduct an inspection, and if they are uncomfortable with what they find in terms of how children are being looked after, being kept safe, etc., Ofsted has the power to shut down the school. So the CQC has that power. What was disturbing to me was that the CQC had rated Modality Mid Sussex as inadequate. They then said that they would be back in 6 months to check things were improving, but they never came back. And I found this very odd. And I thought maybe it was a mistake, because I looked at the website and it said, no, this is the report, we said it was inadequate, we said we'd be back, but they never came back. And almost a year had gone by since when they were supposed to come back by. So I wrote a Freedom of Information Act request to the Care Quality Commission, and I asked them 4 questions. I said, please can you tell me when you came back? Please can you tell me what you found when you came back? Please can you tell me what plans are in place to improve the quality of the service? And please can you provide me with a change log which says these are the meaningful changes that have happened since that show that this surgery is on a pathway to getting better. And their answers were interesting in that first of all they said, we haven't come back, so we have nothing to tell you about the progress. We can't tell you anything about the plans because they are confidential. We've received emails on these dates. And that was it. But then they said, oh, we're going to come back next week. I thought that was very interesting. That was that time. Especially as it was largely unannounced. And what should happen when you come back to a follow-up inspection is you should consult patients and gather their feedback, right? Rather than just going in and looking and seeing it yourself, like, listen to the people. And we had a meeting with the CQC, and they started to explain what had happened and why they hadn't been back and so on and so forth. And as Marion mentioned earlier, we said, look, how have you solicited feedback from patients? You know, we've got a relatively elderly population, they're not particularly digitally native, they may not have access to the internet, they may not have a smartphone. How do you let them know that they're coming back? Oh, we put a posting on the website for the surgery. People to do on the poster. Scan a QR code. And I said, well, can you see we might have a problem here? And they're like, yes, we're very open to feedback. I said, well, how about we leaflet the village? And as I understand it, as a CQC, you can receive phone calls. So maybe we just tell people what the phone number is, and that would be perhaps another way to get the message out and get the feedback. And they thought, yeah, that'd be a great idea. So we wrote the minutes up and we sent them in and said they were a draft and they could tell us what we got wrong. They didn't respond. And then they said they were really busy because they were doing an inspection. I was like, okay. So that's why you've got a leaflet in your hand now, why there's a whole bunch of them to take away. On one side is how do you show your feedback with the CQC. You've got some choices. You can do it online with a QR code, or you can phone them, and they're really responsive. They're great. It's a national call centre. They're lovely people. My wife and I did it 2 days ago to test it out, and the phone was answered within 2 minutes, and we spent over an hour on the phone with a lovely lady who religiously took all our feedback, typing it in. She actually assigned us 4 different case numbers because we had 4 different pieces of feedback. And it was really straightforward. It's a local number, effectively, it's an 03000 number, which is a standard rate. They're open Monday to Friday during office hours, and we're more than welcome to phone them. And it's really important you do, because we've only got a narrow window. So They started their inspection at the end of February, and after the first week of March, they packed up and went home. The physical inspection was over. And yet, here we are talking about this, and perhaps some of you weren't aware that the CQC were inspecting, and you have this opportunity to give your feedback. And we asked them, is there still time, right? Last time it took you 3 months to produce a report. Maybe you could still be listening to patient feedback. And they're like, yeah, okay. And eventually we pushed them. They said, yes, if you get this patient feedback by the end of March, then we will be listening this time in time for this report. Okay? So that's why on the other side of your leaflet, the reverse side, is what we have to say about this, which is we need your help. We need quantity as much as quality. We need to tell CQC if we have issues, what those issues are. And we've summarised at the bottom some potential issues you might be having, and those aren't magic out of nowhere. That's based on the things we've heard from people. So it's there as a memoir, it's there as a prompt, it's there to say, if you have any of these issues, if you have, and you've got things to say, please phone the CQC. Give them your feedback. And they'll be more than willing to take positive and negative feedback. So please bear that in mind. That's option one. And it's a very short fuse. We have to do it in the next 10 days, basically. The second one is NHS Sussex. So NHS Sussex are the commissioner of the services. They take NHS money from above, and they then allocate it locally within Sussex. That's East Sussex, West Sussex, and Brighton and Hove. It's now all one big area. The NHS Sussex budget is about £4 billion annually, and about 10% of that, 400 million, goes into primary care. So the provision of doctors, nurses, and other healthcare professionals that serve people at the first port of call in your local area. Okay? So they get to choose where the money is spent. They get to choose whose bills to pay. And so they also have power. But they don't look at the quality of care. That's the CQC job. They talk about, are we getting value for money as taxpayers? Okay? So, there's one thing to take away from all tonight. Take away all those physical leaflets. In fact, take a bunch of them. Please give them to your friends, your neighbours, your colleagues, anyone that lives in the Modality Mid Sussex area, because that's the current inspection that's happening. And when I say the Modality Mid Sussex area, it's worth noting that there are 4 practices, kind of in this area, I'll explain why in a minute, that are all part of Modality Mid Sussex. It is the Crawley Health Centre that we know and love in our immediate vicinity. It is also Ship Street and Judges Close in East Grinstead. And it's also Parkview in Burgess Hill, which is a slightly odd bedfellow, given it's 40 minutes drive away at peak times, but there we are. Those 4 were independently taken over by Modality Mid Sussex, and then about 2 or 3 years ago they were suddenly merged. And where I used to be able to see data for each individual practice, those 4 sites, I can't anymore, it's just one. There's one unit that's merged, okay? And that may also be why when you go online or you phone up and you might get sent to a different surgery and call you down, it's because they're all being treated as one group, okay? So, please take a leaflet, please take a bunch, please think about phoning in or going online, giving your feedback to the CQC. You have until the end of the month to do it. So, I'd now like to do a little straw poll. Before I just open my mouth, could you put your hands up if you knew that Modality runs the local surgery? Did you know that? Okay. So I would say that's like nearly everybody. Okay? Perfect. Question 2 then. Do you think Modality Sussex are doing an excellent job?
Hands up.
Okay, alright, that's pretty clear. So, have you had a bad experience getting an appointment with the doctor?
Yes.
Hands please, just to be clear. Okay, I'd say that's 70-80%. Okay. Do you know who the Care Quality Commission are and what they do? Yes. Before you came tonight? Okay, that's probably about half. Yeah? Thank you. Do Do you know who NHS Sussex are and what they did before you came tonight? Before I opened my mouth? Okay, so that's probably about 10%. Okay? Which is your local surgery? So I'd just like to get a straw poll so people that maybe come from East Grinstead, they're probably down. So could you put your hands up if you would choose to go to Crawley Down Health Centre? Most, okay. Anyone from Ship Street or Judges Close in East Grinstead? Okay, that's probably about 10. And anyone from Parkview and Burgess Hill? I'm very disappointed no one's travelled from Burgess Hill. So, I was trying to make sense of this, and I still don't think I have, but I'm going to do my best efforts, okay? NHS Sussex commission, I pay Modality Mid Sussex to provide care to patients in the vicinity, okay? The Care Quality Commission regulates providers of care in England, and that includes GP surgeries, it also includes nursing homes, it includes hospitals, etc. So, people who pay, people who regulate, people who provide the service, and us as patients. And then you've got the Modality Mid Sussex Patient Participation Group. You might have seen them on Facebook. They are a group that basically intermediates and helps between patients and modality. And then there's the Crawley Down Health Action Group on the side, and we can try to talk to everybody, but we are not an official group. Right, we're just trying to represent the patients independently. Okay? So, that's how it's supposed to work, that's how it's set up today. So, what have we learned? So, first of all, let's talk about the timeline. Okay? So, CQC inadequate rating was given out in September of 2023. We've been doing our own research, the committee has been tirelessly trying to kind of push the various authorities to take an interest in what's happening, take action, and it's been really hard work. I have one of my favourite phrases, which is pushing water uphill with a brake. It's pretty difficult work because honestly, in the context of NHS Sussex, we're just one, maybe four, depending on which data you're looking at, set of surgeries. They have 160 in Sussex. But we are the only one that's rated inadequate in West Sussex. And it's been quite a long time we've been rated inadequate. So I kind of hope we might get a bit more attention than we've been receiving, if I'm honest with you. So we filed the Freedom of Information Act request, and then suddenly the CQC said, oh yeah, no, we remember, yeah, we'll be back. We'll come next week. So they announced the inspection, and then we had a meeting with the CQC on the 25th of February. We had a meeting with NHS Sussex on the 5th of March. We've had follow-ups with both since, trying to get a bit of clarity as to, is it worth us having a public meeting? Are you still able to take our feedback? And that was a bit of to-ing and fro-ing, but eventually they agreed by the end of the month. And we've had a series of questions open with NHS Sussex. We've posted, I think, 34 separate questions before we went to the meeting. We had the meeting. They said they'd give us some answers by the end of the week. Another week went by. We got some yesterday, was it? Yeah, yesterday. So, 2 weeks after the meeting, I wasn't very pleased with their answers. Let me put it like that. So there's still some follow-ups to happen, and NHS Sussex have offered us another meeting, I think, kind of early to mid-April, to kind of continue the conversation in their words. So we scheduled this meeting, I think, last week. We've got the hall, we've got some posters up over the weekend. We're really grateful to people turning out tonight to listen to what we have to say. And we've got some media interest, right? So BBC, we're in touch with them, and I'm hoping that they come back tonight and what's been discussed. They will write something up that will be in the BBC tomorrow. So it's BBC South, I hope. Normally the way this works, it goes online in the local part. They're really interested, they might put on the news, might put on the radio, and potentially if the national press get interested, then it continues from there. The next thing to do is obviously submit your feedback. I'm going to keep repeating that until the cows come home, because it's really important. And then we would expect the CQC to publish their report, having come back for their comprehensive follow-up inspection. I would expect it around May or June time. So having done it end of February, March, add 3 months, that's what they did last time. That's probably when we'll get their results of their inspection. And then obviously we'll have this ongoing discussion at NHS Sussex, because they're the commissioners, ultimately they can review the contract, they can ask things of modality, and ultimately they do have the power, if they wanted to terminate the modality if there was reason to do so, i.e. they were in breach of their contract. Okay? So, I'm afraid this is where it gets a little bit sad, a bit bad news time. So, I've talked about the CQC supposed to be coming back. So there are over 5,700 surgeries in England. Only 20 NHS GPs are rated inadequate. We are one of those 20. In fact, we're probably 4 of 23, because obviously we're not just one, we're actually 4 different surgeries. Okay. I'm not sure I found another surgery on that list that has 4 separate surgeries that we merged. Together, the 4 surgeries cover about 30,000 patients. Second, if it's not clear already, Modality is a profit-making supergroup. They have bought up several surgeries nationwide, and I'll show you what the timeline is and how quickly they're growing. The data I've got from their website, I think may actually be inaccurate. I think they've actually bought up more in Surrey, since receiving inadequate rating in Sussex, because I believe Smallfield, Crawley, Caterham, I think are also now in Modality's hands. So Modality are building up, not only buying up the surgeries, they're actually buying the land and the buildings. So Judges Close and Ship Street, Modality through their joint venture with Assura PLC, which is a real estate investment firm, I suspect largely backed by private equity, have bought the freehold to the land and the buildings at both Ship Street and Judges Close, and they did that since receiving an inadequate rating. What I find disturbing about that, personally, is potentially an outcome is that Modality Mid Sussex are removed from running those surgeries, but they will still own the buildings. They could potentially, I suppose, lease them to someone else. But if someone comes to recover the service, I don't know whether they'll put the rents up and make it very difficult for someone else to run a successful surgery, but they will still profit by owning the buildings and earning rent. So I found that a bit disturbing. I did check the freehold and the title for Crawley Health Centre and for Parkview Burgess Hill. They are still one is in West Sussex County Council's hands, and the other I think is still in the hands of a PFI scheme when it was first built. But it's certainly a worry for me that Modality might go and buy Crawley Health Centre next. This is a very distressing thing. So a number of you have been probably complaining to Modality. You may have not got much satisfaction. You may have then complained to the NHS. You may then be surprised that your Sussex complaint has gone to Frimley in Surrey. And they were sent there up until December of last year. When we asked NHS Sussex, okay, but you've still got them, right? You can still know what's inside and what the body of the complaints were, the statistics, etc. Yeah, we'll have to check on that. It's entirely possible they don't actually have access to our complaints anymore. We're just waiting for them to confirm, because they couldn't be drawn an answer at the meeting. So there's a definite chance that the baseline of what we all thought and how we rated this service and how we complained about it, it's gone in the bin. Okay? It's unclear whether Sussex money is actually being spent in Sussex. This was a particularly disturbing revelation to me. In the town council meeting in East Grinstead in 2023, the CEO of Modality came to explain what they were doing, that they were taking over the surgeries, and they explained various parts of their operating and contracting model. Modality Mid Sussex, as far as I can tell, does not exist as a legal entity. It's a division, which is an informal part of Modality LLP, and various other Modality companies make up the entire group. What it appears to me is NHS Sussex, as the integrated commissioning board, I think is the right word, send money to Modality in Birmingham, and they then decide how to allocate that money to their various surgeries in their network. So I'm not on confident at the moment that Sussex money goes through Birmingham and comes back to Sussex. It will go to other surgeries in the modality group. I have no way of proving it, and I asked the question of NHS Sussex. I said, you know, you've been paying millions. You've obviously performed a financial audit. No. Do you have any assurances that money's coming back to Sussex? Don't know. And obviously, because of modality supergroup structure, there's a certain element of the service that is administered centrally. And so money goes to some part of the modality group that doesn't necessarily come back to helping us as Sussex patients. I got a little bit of the data geek in me, and I went to NHS England. I should say RIP, because they're about to be shut down. But NHS England does produce public data where you can go and query and look at various statistics. And NHS England produced statistics pretty much every month. It's a bit of a lag, but they're very useful data like how many GPs work at a surgery, how many full-time equivalents, i.e. if there's some of them part-time, how much time they actually spend, how many they have in terms of headcount, how many GPs, because some of them are part-time or locums, etc. Modality Mid Sussex, when you compare it to Moatfield, when you compare it to West Sussex, when you compare it to Sussex, when you compare it to the South East, when you compare it to England, has a worse ratio of patients to GPs. It's also clearly, from my perspective, becoming increasingly reliant on locums, and those locums are often not in person. They're on the phone, and they could be anywhere. So what alarms me about that is the old GP model used to be someone in your community you kept on going back to, and it's what they call a continuity of care, right? You see the same person, they know you, they know about all your different issues, and so they can prescribe and diagnose effectively because they have the backstory and they know you, right? I don't know about you, but every time I've had a GP appointment, if I get one, normally by driving to Burgess Hill, I see a different doctor.
I eventually got an appointment for next Wednesday.
Congratulations.
And I said, can I have the name of the doctor, please? Oh, it's a paramedic.
Ah, interesting. Okay, yeah. So the NHS is stressed, right? That much is clear. But yes, it does seem that there are a variety of healthcare professionals that are engaged in what we would normally think of seeing a doctor. So my recent experience, I wanted to get a blood test. I was sent through loops online. I'm quite digitally savvy, right? I think I'm doing all right. And then eventually I got a text message, despite not actually having SMS consent, but it's another story, which said, oh, you've got an appointment, judge's close at 8:50. I was like, okay, interesting. Who with? There was no name on it. So I went into the surgery and said, you booked me an appointment, I don't know who it's with. Oh, we'll look it up. Okay. Oh, it's this name. So, okay, great. Are they a doctor? No. Okay. Are they a nurse? No. Okay. Who are they? They're a healthcare assistant. They're going to take blood out of my arm, and apparently that's okay. I was like, okay, fine. You know what? I think I'm going to go to Crawley Hospital. They have a phlebotomy department. They do it every day. I'll go to them. So, it's very interesting feedback you have there, because I think there's quite a bit of that going on. And it's not very transparent to me when an appointment is booked who I'm actually going to see. I don't see a name. I definitely don't see a role. And when I think about it, it's like this surgery has been rated inadequate for now, well, they did it in May and June. They only published it in September, but effectively it's coming up for nearly 2 years since the inspection originally. And I think part of the problem is that in a competitive market for doctors, which doctor is going to want to come and work here? I mean, if I was a doctor, I'd want to go and work in a well-rated GP practice. I'm not sure I'd want to go and work in one that was the bottom 20 out of nearly 6,000. That wouldn't be my first choice. And so I think it's become a bit of a millstone around our neck. It's going to be, I think, quite a difficult cycle to break out of. And if you look at the 4 separate surgeries that used to be Modality Mid Sussex, before Modality took them over, they were all rated good by the CQC. They were all inspected in either 2016 or 2017, and they were all good. Modality takeover 2019-2020, CQC comes in 2023, and suddenly they're all inadequate. So, rapid health. As I said to the CQC, I said rapid health, 2 words, both misnomers.
James, could you just raise your hands if you do the rapid health online? Very tax, I think.
Not bad. Anyone used rapid health and it been a successful, pleasant journey? Okay, that's good. We've got some people that are happy with it. Okay, that's good to know, right? So my understanding is, and one of the reasons actually the CQC said that they didn't come back within 6 months was because one of the problems was getting through on the phone, and they wanted to give Modality time to implement their new online system. I'm not sure if they didn't realise that part of the problem you couldn't get through on the phone was actually because there were no doctors to see. But obviously this online system was going to be, once it was implemented, and obviously it took a long time for it to be implemented, then once it was implemented they could come back and check whether things were working out okay. I've worked in financial services for a long time, I've worked in technology for a long time. Never in my life have I seen an online system developed that is only open Monday to Friday from 6 AM to 4 PM. To request them, not even to look what, to ask for. I explained to CQC, we are about 10 miles as the crow flies, maybe less, to gather. We have a lot of people who work on shift. We have a lot of people asleep during the middle of the day or at work. Why can't they ask for an appointment on Saturday afternoon? What's the harm in that? Or is it just a method to try and deter and obstruct people from getting the care they deserve? It turns out that if you push certain buttons on rapid health, you get to the answer faster. But if you have something that's a bit complex or maybe not in the usual grid, you have to fill out pages of stuff. And I find it quite upsetting that a number of people reported to me, like I've experienced it myself, you walk in person and say, I'd like an appointment please, at reception, they go, please fill online. Why? I'm in front of you. Well, I have to ask you lots of intrusive questions in a public setting. It's like, well, you could take me to a private room if you need to do that. I'd just like to see a doctor and discuss it with them. Not possible. It's it. So there's this kind of coercion for me, kind of trying to get people through these digital channels, and some of those people can't. Not necessarily won't. They can't. And I find that quite upsetting. And then the last one is about the travel. So, under the contract, Modality are required to provide a suitable premises to provide care. I have an open question, and the CDHD has an open question, which is Burgess Hill a suitable premises for Crawley Down residents? Is it acceptable? I worked it out. It's an hour and 15 to cycle. It's 5 hours to walk. It's an hour and 15 on public transport. And on a bad day, it's about 40 minutes to drive each way. I'm just not sure why people are being asked to go so far when there's a perfectly good building, largely empty and unused, where people could be seen in their convenient local location.
Why can you get an appointment far sooner at Burgess Hill than you can?
Yeah.
Because I've been waiting for an appointment and I could have got one 2 weeks ago at Burgess Hill.
Yeah.
I've got to wait another 2 weeks to resource it.
I have a hypothesis about that. So Burgess Hill is a growing town. Lots of new houses went in. Quite young, quite healthy, and there are lots of other surgeries. And so I think what's happened is, the way the money works is a GP surgery gets paid a capitation. It gets paid £160 for every person on their books, regardless if they see them or not. So if you've got a young, maybe commuting, who can go to a doctor's at work, as a walk-in in London, or whatever they're doing, they might never set foot in that surgery, but Modality will at £160 extra. But if you are a patient at Burgess Hill and really want to see a doctor, you probably register to a different surgery. And I find it amazing that I'm in a very fortunate position, so I've got a bit of time, a bit of money, I've got a car and a license, and I can drive to Burgess Hill if I really want to see a doctor. But I know a lot of people can't. And I also know that only certain clinics are held in Burgess Hill. So the female hormone clinic, for example, so if you want, you're on menopause, you want hormones for that, the specialist, the modality is based at Burgess Hill. So unless you're prepared to travel there, you're not going to see some. So, those are words. Here's a bit of proof. So these are the 20 worst surgeries in England that are all rated inadequate by the CQC. We're in yellow here. We're the only one in West Sussex. There's now one in East Sussex, interestingly. But this is date audit. So for those at the back, this one at the top was rated inadequate in March 2025, so just a few days ago. This one was in August 2022, and obviously we were rated there, went on the register on the 26th of September, the day before they published the report. But, you know, most of these have been cured or have been shut down. But we're still waiting for our satisfaction. So that's public data. You can go on the CQC website, they will produce that list for you. So Modality profit making supergroup. So this again, I'll talk it through because it's not easy to see at the back, but it started out with their founding division in Birmingham in 2009. They've got 13 sites and 90,000 patients there, according to their website. They then brought in Hull, 4 sites and 60,000 patients. Wokingham came in, 2 sites, 24,000 patients, and Surrey Hills. So areas around the northeast, the Midlands, and now increasingly the east and the southeast. And I think this actually, Mid Sussex, it says here, was April 19. I think there have been others in Surrey that have come on board since, and maybe others in the country I don't even know about. And when we say it's a profit-making supergroup, it's a pretty complex beast. It took me quite a while to put this chart together. It's all out of public data in the company's house. And you have these various interesting things. So they've got these kind of 5 group entities. And we know they're related because they have a fixed and floating charge from Barclays Bank, which allows them to borrow money from the bank to finance their activities. And you can see, Modality Medical Services have got 4 million in equity. Modality LLP did 22 million in turnover, sorry, made 1.6 million profit. This is this clever thing here, Digitality LLP, that's their tech arm. So probably producing lots of wonderful things like rapid health. And they've got a few investments in private companies because they've got money to invest. And then this side is quite interesting. So this is Assura PLC. They have a limited company under that PLC, Assura Property Limited. That Modality Property Investments have a joint venture called Thea Investments, and that entity is the one that owns Judges Close and Ship Street that they bought 2023-2024. Okay, they paid 1.1 million for Judges Close in the 8th of March 24, and they bought Ship Street for 1 million in 2024-23. Now you might be asking, where does the money come from? I mean, we've got probably some investors in Assura PLC. They brought some money in here. Barclays Bank, we know lending to them because there's a charge over those group companies. And maybe the partners put some money in because they thought this was a great deal. I don't know.
James, that's recent. The Barclays money is a new debenture which arrived in January.
Right.
It looks as if they've been largely self-funding up until then, in terms of capitalisation.
Yeah.
But
So
they've taken on big borrowing suddenly.
Well, let's be clear what self-funding means. It means they took money from NHS and they didn't spend on patients. Right? Let's just be clear about that. And then these two here, these are separate legal entities. Again, the Modality name, they own 2 of the properties in Birmingham where they started out. 1.6 million they paid for, the value of Senate, and 2.6 of Bellevue and Edgbaston. Okay, so it feels like it's a property business that happens to serve patients occasionally. And that was the proof. So those are the title registers from the government website that shows that Fiat Investments, the joint venture, owns Drone Dispose and owns Ship Street. Okay? So it's not me just saying it, it's fact.
Excuse me, who owns the freehold before? Is it the council?
I actually don't know, but there is a typical model, to be honest with you, which is independent GP practices often own their land and their building, and it's part of the thing they pass on when they retire, they sell it to other partners. But I don't actually know. I haven't had the chance to dig into the title deeds, but I can look it up.
James, again, I can perhaps add a little bit for you there. The business model of Modality from its beginning has been that it provides a route for GPs who want to cash out of their practice. And for the model as to whether the practice owns the building or not has varied across the country quite a bit. In some places, and I believe back along here, when we first came to the area, I believe that the GPs had a bigger equity in the property than they had, they probably had at the end.
Yeah, I'm sure there are mixed models. We know obviously the other two in the Modality Mid Sussex group. So Crawley Health Centre is not owned by Modality yet. I think that's still in this Pier 5 field. And then the one at Park View is actually owned by the council. It's West Sussex County Councillors has the title for that. So, Sussex money gets spent in Sussex, who knows? Right? They have this kind of contracting structure, it seems, and that comes directly from their own slide that was presented at the East Grinstead Town Council. So, NHS Sussex gives money to Modality. We then decide to allocate it or not to Mid Sussex. We then decide where it gets spent in the local area. Right, the data on NHS England's data on ratios. So again, small slides, I'll just explain it. So the blue bar is patients per GP full-time equivalent. The orange bar is patients per GP headcount. So what does that mean? Well, I could have two doctors, but they both only work part-time. That's only one FTE. Okay? So Moatfield, 1,500 patients per full-time GP. Modality Mid Sussex, 2,000, which is more than the East Grinstead primary care network, more than Sussex, West Sussex, the South East England, and this little bar I constructed, which is all of the other Modality sites. So we're actually, Modality Mid Sussex is worse than the rest of Modality. So I'm like, again, is the money in Sussex coming back into Sussex? What's going on there? And then this black line is the ratio of headcount per FTE. So in other words, are we seeing a lot more doctors who are all part-time and a bit remote and locums, etc.? The answer is categorically yes. We're at 1.74, whereas Mocha is 1.28. So more better continuity of care there, and pretty much the same across the board. We stand out as the worst example. We are above the average. Sorry, below the average, depending on which way you look. Okay? And then that was the spotlight as of the 31st of December 2024. And this is the ratio over time. So now I've split the bars. So blue is 2014, 10 years ago, and orange is 2024. So Moatfield, 1,800, got better. Only 1,500 patients per GP. So in 10 years, they've done well. There's more doctors to see patients. Modality in Sussex, that's a composite of the 4 separate surgeries that were reported separately until they merged. It's got worse. So, I need to read this statement from NHS Sussex. So, we thank everyone who's come out this evening and joined this meeting to share their experience of Modality in Sussex, and in particular access to services in the Crawley area. As we discussed with members of the action group when we met 2 weeks ago, the CQC re-inspection of Modality in Sussex is currently underway. Well, the physical part is actually finished already, but we appreciate that there is frustration about the length of time that it has taken for the CQC to revisit Modality and regarding access to services. Their inspectors have been meeting Modality and receiving updates monthly on the action they have taken to address the areas in their 2023 report. And the current re-inspection will consider the impact of this action, or if they continue to have concerns about how the practice is working. The Freedom of Information Act request I submitted, by the way, is public knowledge. And it only gives a few dates as to when actually there was interactions between Modality and the CQC. The CQC is able to consider feedback from patients as part of that process. Take a leaf at a time, please. Alongside the latest data from the practice overall. Yeah, practice overall is interesting, because I don't know if they've got data from the individual sites anymore, but it might just be all four merged. And each of the 4 surgery sites, well, let's see, because we've not seen that data yet. They've said they have it, but I'll believe it when I see it. And further evidence from the practice, I'm not sure what that is. We recognise that the group has therefore brought you together tonight to help to collate that feedback and feed this into the process. So, I have no desire to sit between you and the CQC. Please tell them everything they need to hear. That is a private conversation between you and them. They are required to keep it confidential, and you can say whether you would like it shared with Modality or not. It is totally up to you. We also remain committed to meeting with people registered with this practice when we know the outcome of the re-inspection to discuss that next step together. I think that means we're not interested in talking to you until May or June. Because basically what we're doing is saying, let's wait and see what the CQC say, even though we spend the money. So, that's the statement from Mid Sussex. And now it's very much time for questions. Thank you very much for paying attention. I know it went a little bit longer.
Can I just add one thing? I was told reliably today that the emotional wellbeing service has been terminated with Crawley Down Health Centre. So the only place that's carrying it out is Moat Road. Now, I don't know if any of you have encountered the wellbeing service, but I do know that there are younger people in the village that have used it, they won't be able to. And these are people that for whatever reason need counselling. And I hope somebody is writing that down and taking it back, because the contract has been terminated in 2025. That's how much they care. Questions?